Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Raj Lakshmi R. She is a renowned gynecologist obstetrician of Udupi, and she was the past president of IMA Udupi. And apart from that, she is a prolific writer, and she has been writing as a columnist, and also she has written a book, Vatsella the Osuge, for the people, A to Z, everything about how to take care of the womanhood. And apart from that, she goes to schools, colleges, and teaches the teenagers how to take care of their health. But today, she has come to tell us about the health of the pregnant woman. Because the moment the woman becomes pregnant, it is a happy moment. And if we don't want anything to go wrong and unhappy things to happen, one has to be very careful. So she is going to tell us about the care of the mother when she's pregnant. Please, Raj Lakshmi, tell us why this antenatal care is so important and when it is done.
Thank you, ma'am. Thank you for the opportunity. Namaskara. Antenatal care is the care of a pregnant woman. So she has to visit a doctor so many times in her pregnancy. Usually they used to come after 3 months, and there have been even home deliveries. But since there has been lot of changes in the present scenario with as pertaining to the lifestyle, the atmosphere, pollution, so they usually land up with some complications. So we tell them they should come for antenatal checkups and they should have an institutional delivery. So what do we do in these checkups? How many checkups they should come? Usually we tell them to come first in the beginning as soon as they confirm that they do themselves. They do a urine test and they confirm and they say we are pregnant. So that time itself they come, it's good for them because when they come for the first visit, we check their height, weight, their BP, their general health. Along with that, we do some blood tests like the hemoglobin to rule out anemia. Then we do our blood sugar levels to rule out any diabetes. We check their thyroid functions as also vitamin D. So these are the blood tests which are done. And next we also do the scanning. Usually we do a transvaginal scanning to see whether they have conceived properly, whether the embryo is within the uterus or it is outside, lying outside.
Like
How many
ectopic
embryos
pregnancy.
are there?
Yeah, okay.
Yeah, ectopic pregnancy. Are they having twins? And is the baby growing well? Has it got its heartbeat? And any other problems in the uterus, like whether there is a fibroid or a cyst, something. So to see this. So all this is done in their first visit. As also nowadays we have what is called as gestosis scorecard of some 30 factors depending on their age, parity, old age, their past history, and we categorize them whether they are low risk or high risk. If they are low risk, we call them once a month. If they are high risk, they'll have to come every 15 days or depending on the severity of their risk conditions.
Okay.
Now, what do I mean by high risk is they may be obese or they may be too less weight. They can be having diabetes. They can have high blood pressure. They may be previous cesarean section patients or they may be Rh negative patients. So these all falls into high risk pregnancy. So they have to be seen more often. So this is what happens in the first 3 months now. So next 3 months, usually next 3 months is the second trimester, what we call. Usually it's a cool period because they will also start enjoying the vomiting might have stopped and they start feeling baby's movements and the uterus starts showing up. So they are also happy that something is happening inside them. But still they should come. They should come and visit the doctor, check their BP and their sugars, and scan has to be done again. We call it as TIFA, or which was called anomaly scan previously. So we see all the parts of the baby, of the fetus, to see whether there are any anomalies. And when we check sugar,
and this is the very important part, because if there are anomalies, difficult to treat or what to say, some sort of syndromes are there. Termination of the pregnancy is possible only now. Once they cross, then termination cannot be done, they have to
if
suffer.
they cross 24 weeks, it cannot be done.
Done.
24 after 24 weeks, according to our law, we have to go through the medical board and all get it done. So why this scan is done? To rule out anomalies, and even fetal echo is also done, ma'am, to see, especially if
yes.
fetal echo is done to rule out the heart anomalies.
Mm.
And I want to stress one point on the sugar test. We don't do random sugar or fasting sugar. Usually what we do is glucose challenge test. There's no need of being in fasting. We just give them 75 gram of sugar, and they are, after 2 hours, we check the blood sugar.
Mm.
And the sugar should be below 140 milligram. If it is more than that, we diagnose as gestational diabetes. So this is the way
Diabetes,
sugar is tested for a pregnant lady.
Okay.
So they cross these 3 months, then come to the third trimester. Then again monthly visits, and as they near their delivery date, we might call them every 15 days.
But what about
Again,
the
we do another
vaccination?
scan.
When do you give the vaccination? When do you give the
Vaccination, yes, ma'am. Yeah, we have to give them. Previously we were giving only TT, and then now shifted over to
That is
TD,
the
and we have
tetanus
added
toxoid.
toxoid,
Instead of-
and we have added with the pertussis also and influenza vaccine. Usually, there should be, previously it was told 1 month difference. The gap should be there between the two vaccinations. Usually the first is given in the first trimester. The second one is better to give closer to delivery, so that the,
Okay.
the baby gets
Baby also
best
gets the immunity.
benefits
Okay.
during its the first 1.5 month of life. So it is given after 28 to 30 weeks it is given.
Okay.
And then again, third trimester, when they come, we do again scans. Why do we do this scan? Now we have to see the growth of the baby, the weight of the baby, position of the baby, whether the head is down or the breech is down, and
If
how
there
is
is
the
a breech
placenta.
presentation, then that would be a problem, So whether she is capable of delivering normally or she has to go for cesarean, all that decision has to be taken. Yes.
Yes.
Very
If it
important.
is a breech delivery, breech position, the baby's buttocks will be down, and it is difficult for a normal delivery. So we might have to go for elective C-section. We also look at the liquor, the amount of liquor inside. We see the position of the placenta. On Doppler scannings is also done. In case of there is less liquor, or maybe there are twins, then we do the Doppler study, the blood supply to all the organs. And we measure the uterine artery, we measure the middle cerebral artery. So like fetal Dopplers we do to time the delivery. So that is why many scans are done. People might think why we are doing so many scans. Is there any harm in these scans? No. We have
Absolutely
certain
safe. Yeah.
The heat exposure to the baby is very minimal, and we have only this duration time, only that much we give and do the scanning. So it doesn't affect the baby at all.
Okay.
So this is the essence of antenatal care. So to see that the mother is fine, baby is fine, the baby's growth is well. So along with this, we give them some suggestions, some counseling also.
That is very important, because not only the vaccination and the anomaly scanning, what is important is what they eat and how they do and how they sleep, and also the regular exercise or yoga, especially for the normal delivery. Yoga is also good. Yes,
ma'am, it is good. Usually they come with the letter chit pad, or they will have questions in their mobiles. So we have to answer, because they get information from everywhere, and we have to give them the proper information about the food, about the exercise, about their rest, all that. About food, except for papaya, we don't tell them to avoid anything. Papaya, because it has papain, we tell them in the early trimesters to avoid raw papaya. They can have all types of food, and exercise is important. Nowadays, people think that pregnancy means bed rest. No, bed rest will lead to more problems. So they have to be
bed rest
active.
is given only when there is some threatened abortion or something. Some complications are there, then only bed rest. Otherwise, no.
And they have to do exercise under the guidance of their gynecologist. They should take a permission from their obstetrician and do. It is not severe exercises and heavy exercises shouldn't be done. Of their choice, exercise can be done. And they have to take rest. They have to sleep in the night as well as in the afternoon. They can take a short nap. And it's best if they lie down on the left side, so that the blood supply to the uterus and the fetus is maximum.
So when they sleep on the left lateral side, the uterus will not compress on the inferior vena cava, causing the stresses and block.
Yeah,
Very
otherwise
correct.
sometimes they get postural hypertension when suddenly they get up,
Yes,
they feel
yes.
giddy.
Blood
So
pressure
we tell
comes
them it's
down and
better
then,
to,
yeah.
yeah, better to lie down on the left side. And as the pregnancy advances, once they cross 7 months, their weight is also increasing, and that should be healthy weight gain. If they're gaining more weight, they are putting on more weight. There is puffiness of the
And if there
face.
is
There
a
is
puffiness or edema, water collected in the
uh,
legs, all that has to be seen.
yeah,
Okay.
all that we have to be more careful because that can be due to hypertension. So we
Okay.
have to be very careful. There is a physiological edema also. What happens? Usually it is seen only on the one leg, and when
Yeah.
lying down, it comes down. Only when in the evening, by evening, it increases. That is okay.
Okay.
But if it is persistent edema, they have to take care and they have to visit their um, gynecologist.
Gynecologist. Okay.
Yes.
Okay. And regarding the food, how do you advise them? What sort of food they should take? Because there
They
was a
have
time
to
they used
eat
to say like
healthy.
baike, they have the desire to eat all sorts of things and katta meeta and all that. And so all the
Okay.
neighborhood, everybody used to invite them and give them a very delicious food. But now that is not there. So these women, they
Okay.
are alone
So
and have to, yeah. Hmm.
yeah, usually in the first 3 months they might have vomiting, so they may not feel like eating, but
Hmm.
still they should continue eating nutritious food. There's no
Hmm.
restriction on any other food. Or there is the belief that you have to eat for two people now because there are two
Yeah, yeah.
lives. Nothing like that. They have to eat healthy, nutritious food which contains all the nutrients required for the growth.
So
It
lots
should
of fruits
prevent
and
anemia.
vegetables,
It should,
so that to avoid the
yeah, vegetables
constipation
with
also
the fiber.
and constipation. Yeah.
Yeah, with fiber to avoid constipation, they have to eat. And they have to, after every meal, it's better they walk for 10 minutes so that that gets digested also well and they don't get the regurgitation. Usually, once the baby starts growing up, after 7 months, the uterus presses on the stomach and
Yeah.
they feel
There
the
is a
heartburn.
compression. Yeah.
So they
Yeah.
have to, yeah, they have to eat in moderation, restrict spicy food, tangy food, very hot food, and
Mm,
especially fast food and
mm,
aerated drinks. All these things they should avoid. Otherwise, there
mm.
is no restriction as such, and no need to add too many things. Also, they say if you add a kesar, the baby becomes fair. There is no correlation between that. They should have a
Okay.
healthy diet. That's all.
Okay.
With
Okay.
minimum exercise.
And no
Yes.
junk food, no aerated drinks, you said. And they must have the milk and vegetables and fruits. So
Yep.
thank you very much, Dr.
Yes.
Raj Lakshmi, for explaining so clearly and candidly how to take care of the pregnant woman. Thank you.
Thank you, ma'am.